दोस्तों बिफोर वी वाइंड अप, विल जस्ट हैव अ शॉर्ट डिस्कशन. आपसे ये सवाल पूछना है, हमने तो वी वेंट थ्रू कोविड 19 जो था, अभी 2.5 साल तो निकल गए. अभी लॉट ऑफ दिस वेरिएंट्स आ रहे हैं, वेरिएंट्स जो आ रहे हैं, तो उसके बारे में हाउ मच इट इज़ गोइंग टू बी सो मच हैविंग इफेक्ट ऑन हेल्थ ऑफ पीपल. तो इट्स जस्ट लाइक इम्यून, मतलब बिल्डअप हो गया हमारे कोविड-19 वैक्सीन से, जो वी कैन स्टिल फाइट इट आउट.
No, I think the variant are, see, the way we treat the disease, the virus wants to also fight against our treatment.
Oh,
So that's what they do. The gene, they multiply, they try to avoid your medicine and to come out with a new variant. So
mutation.
mutation. They mutate. You treat them, but they mutate. They want to fight it out. They want to continue their journey, whatever you describe.
Right.
So you have to follow really the guidelines of this federal government, because they produce the different kind of vaccine which is really effective, and particularly those who are above 65.
अच्छा.
They should be very, very alert, you know.
Okay.
Still,
मेरा एक क्वेश्चन है डॉक्टर साहब, कि जब कोविड-19 आया था तब वैक्सीन्स नहीं थे, तो ऑब्वियसली नाउ वंस द बॉडी बिल्ड्स अप सम इम्यूनिटी, द सिविरिटी ऑफ द इफेक्ट ऑफ द वेरिएंट म्यूटेशन जो होके आती है, तो बॉडी कैन स्टिल हैंडल, इट्स नॉट गोइंग टू बी एज डेंजरस एज कोविड-19, राइट?
No, that is true. We do develop immunity, but yeah. So now the disease is not as severe.
Right.
As it was before. Still, once you become 65, then 70, 80, still the immunity and the power of fighting is much less.
Okay.
So you should really still follow the guidelines of the federal government and take the vaccine. So, and then there is a new flu type of vaccine has come recently, variant. And so that is also, the flu vaccine is not that much effective on that. So that other vaccine has come just recently.
मेरा एक और सवाल है, ये जो फ्लू वैक्सीन बोल रहे हैं और शिंगल्स बोल रहे हैं, तो पीपल हु टेक इट, I mean, they not that they're immune, they never get flu, they still get flu, right? Different next year, following year, 2 years. So what's the point of getting vaccines then? It's a waste of money, right?
But they give you the power to fight, against the virus, definitely, you know.
Achha.
And particularly when you become 70, 80, and then you have multiple medical problem also.
Okay.
Diabetes, hypertension, some people have cancer, their immunity is less.
Right.
So those people have to really much alert.
Okay, natural immunity goes down.
And particularly people, when we go to when crowded place, then it is advisable to have a mask, you know, when you go to really crowded and very congested place.
Right. I mean, there is one question I want to ask you, if you have any idea about that. ये जो लाइफ स्पैन जो होती है, आई मीन ह्यूमन बींग्स की लाइफ स्पैन 50 साल, 60 साल, 70 साल, 80 साल, वॉट एवर एज, तो इज देयर एनी पर्टिकुलर, आई वुड से समथिंग इन द माइटोकॉन्ड्रिया जो बोलते हैं सेल में, दैट हैज ऑलरेडी अ प्री डिटर्मिन्ड एज फैक्टर इन दैट, कि the mitochondria as the age gets shrink, finally it stops and then we die?
No, I don't know much about that, so I cannot comment on that.
Okay. नहीं, क्योंकि मैं सोच रहा हूँ कि some people die quickly, some people die late, some people, but disease एक बहाना होता है मेरे ख्याल से, कि लेकिन even people overcome that disease and still they live, because the mitochondria जो keeps on producing that, as it keeps depleting, तो totally deplete होने के बाद the cell doesn't survive. I think that's the, पता नहीं कहाँ पड़ा था, my mitochondria is something in the cell.
No, I don't know much about that part of that. But one variant are coming, and once you read about that, said you can ask they can ask the other physician also what is the point. But usually federal government is try to be on top of that.
Achha.
And
Okay.
and then they provide vaccine. And I think particularly senior people much should be much alert, and also those who have diabetes, those who have cancer, those who have less immunity, they should be really alert about that, because many people you saw die at that time with pneumonia,
Ha, ha, ha,
which
ha.
is viral pneumonia and very difficult to cure, with the medicine.
Pre
Medicine.
pre-existing conditions, you mean?
Exactly. Yes, they
But
should be
but
very
even without virus, people still can die, right? Some infection से हो सकता है.
well, definitely.
Bacterial. Okay.
There are viral. People have even heart attack, and people have
Correct. 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 Correct.
cancer, because they say after 85 years of age,
Uh-huh.
one in 6 person
जी.
will develop a new cancer. When you become 85, one in six,
Uh-huh.
the new person will still develop a new cancer.
85 years के बाद.
85 years के बाद chances of developing cancer is still with one in eight woman and one in six men.
Can develop.
Yeah. So
अच्छा अच्छा.
sometimes you hear surprisingly, I have my friend that they have liver cancer, ovarian cancer,
Uh-huh.
breast cancer. So that comes, you know, I think gene lose the control of certain cells, and
Uh-huh.
and they multiply and they grow. And if it not taken care, then they go everywhere in the body.
ओके मेरा क्वेश्चन ये है आपने कहा 1 in 6 आफ्टर 85 years सो अंडर 85 what is the percentage 1 in 5 1 in 2 1 in 3 or more than that 6
No, that actually I don't know. This I have really read and remember. That's why I tell
okay
you.
okay okay okay
Because if I don't know, I don't want to tell about
okay
that.
okay
But
okay
as you become as you become senior and senior,
mm.
chances of getting is much more than before when you are young. That is evident.
अच्छा 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 okay all right दोस्तों if you have any questions for Dr. Desai please do text us on WhatsApp if you have time we will try to answer before we wind down this afternoon's program all right, so thank you very much Dr. Desai for having joined us and given some insight about your share shairi and some jokes and some medical kind of information as well